well, good morning, everyone, and good afternoon for those of you on the East Coast. Matt Simmons here from Simtech Solutions. Thank you for taking the time today to talk through strategies for conducting a safe, accurate, and efficient point-in-time count in the midst of this COVID pandemic. And we'll start with a little bit of ground rules.
Great. Good morning and good afternoon, everyone. My name is Nikki, and I'm a Community Impact Advisor with Simtech. We also have Kevin and Becky on the line from Simtech. So just a few of the rules before we get started today. Everyone is being put on mute upon entry, but if you have a comment or a question, you can use the chat feature or raise your hand, and our team will be monitoring the chat, making sure your questions get answered, and we can unmute you. We'd love for this presentation, this webinar, to be interactive, so please don't hold back. If you have questions, we will be happy to answer them as they come up. The webinar is being recorded, and it will be sent out to all attendees following the session, and you can feel free to share that. And if you did not register, but you would like to receive the follow-up email, please submit your contact info into the chat, or you can send it to one of the Simtech team privately if that's what you prefer, and we'll be sure to get you the follow-up email and recording. All right, Matt.
All right, thank you, Nikki. A little background on Simtech for those of you that don't know us. We've been in this space since 2002. The company was founded in 1998. We're a finance company, a tech company focused on finance originally, and then pivoted once we realized we could actually do things that we're passionate about. So we've developed the first HMIS data warehouse in the US back in 2002, and have since just been expanding on our framework, adding to our staff, and trying to deepen our impact in the work to end homelessness. And so some of the work we're going to talk about today is related to that. Why do we do the count? Well, there's a few reasons. It's a vital tool for community planning. We have annual trend analysis, so we can see, are we making a difference? Are we making a difference in the wake of what's happening with the pandemic, what's happening with wildfires? You know, maybe you have targeted initiatives towards add permanent supportive housing, better street outreach, diversion efforts. What's working and what's not? And this is a barometer to help flesh that out. Resource allocation strategies, I mean, that's related to how you're queuing up your resources and what's making a difference. So, you know, both locally, but also at the federal level and the state level. So at the federal level, you're seeing appropriations being made using PIT data. Here in California, they relied on the PIT figures to distribute the monies across the 43 COCs, I believe it was HEAP dollars. You can also use the point-in-time data, especially the geospatial features, to support things like voter registration campaigns, which is very timely with the debate coming tonight. The US Census, you know, every citizen, whether housed or unhoused, deserves to be counted. And so you can use the point-in-time data to inform where the census outreach should happen. For COVID-19, it was really helpful to have the PIT data to help inform any some targeted interventions specific to supporting shelter-in-place model, getting people, you know, taken care of, and identifying at-risk populations, and the prevalence of those people with higher vulnerabilities on the streets. And so we'll share a little bit about that too. Beyond that, the annual point-in-time count is really a unique opportunity to gather data on the unsheltered population. We do have HMIS, which is a longitudinal over time picture of homelessness, but traditionally the HMIS has not been a great way to measure the unsheltered population just because of issues with data quality. So as an example of using the GPS-enabled point-in-time data, you know, here in San Diego, where I happen to live now, we used the data from the point in time to inform the placement of hand washing stations for the county, and they were able to look at the heat maps and say, well, this is an area where there's a high concentration, and therefore we should put this hand washing station there. Right now, we're actually supporting a meal distribution program in the area, and we're up, you know, you can use this information that we gathered when we do a full canvas of the county to say, where should we send people out to give out those meals? So there's that. And then beyond that, we have the CDC has published guidance on what it's needed in order to support a shelter-in-place model. So if you have an encampment, what are the basic supplies that are needed at that encampment so people can have a stable living situation, you know, relatively stable, you know, sanitation supplies, a place to go to the bathroom, food, things that typically require mobility. And if you can bring the supplies there and make sure it's clean, that they have PPE, you know, basic education of what COVID is and their risks, we want to be able to support that too, just given that we don't have enough shelter or housing beds for everyone, unfortunately. So obviously there are challenges for conducting a point in time count, and there's challenges for doing anything right now. There's challenges, you know, to use the parks and what have you, and going to restaurants. But those, you know, are an issue that we're gonna have to deal with if we're doing the point in time count. And, you know, so some basic common sense and things you heard over and over again apply here, just like they do anywhere. You know, PPE makes sense, social distancing makes sense. We'll talk about those things, but some of the other challenges that might come up that we haven't faced in the past, potentially a lack of staff capacity, not only high turnover rates, some of staffing is shortened because of COVID, whether it's budget cuts or people that have childcare needs and can't support their current jobs and take care of their children who might be homeschooling. You know, there's real life situations happening. You may have a potential decrease in volunteers. Well, that's to be determined, and really it'd be interesting to see what happens. So, you know, people that might be, you know, trying to limit their exposure may not want to participate in the count. But again, there's ways we can overcome this. And so, like, the general concerns over safety, you know, not just for the count volunteers, but the people experiencing homelessness. You know, we're trying to minimize interactions in general and contacts. You know, that's how this disease is spreading. So how can we get around that? And so, you know, we're going to highlight some of the areas of opportunity to do just that. So here are some strategies that we'll kind of talk through. And again, the chat, if you have additional ideas and suggestions, we're all learning as we go. Fortunately, this is the first time we've all lived through this type of pandemic. But, you know, we are relying on our community partners. We're relying, and when I say community partners, you can call us, you know, a client, someone from, you know, HUD, anyone that cares about the homeless population we're serving. If you have good ideas, share them, we'll share them. You know, we're learning together. So how we break down the counts in general, whether COVID's happening or not, is pre-count, during the count, and after the count. So you have three main phases. So we're going to talk about preparations and things you can do as it relates to COVID that will hopefully alleviate, you know, some of that potential risk exposure. One of the main things that you can be doing now is identifying locations known to contain people experiencing homelessness. So, and we'll talk about that through a little bit. Establishing your regions and your count teams, and then having volunteer registration portals to support assigning people to those regions and count teams. During the count, you know, ideally you're supporting real-time data collection, and you know, I know a lot of people on the call are clients and have already realized the benefits of real-time data collection versus paper and then rekeying things. So I don't really have to go too hard into that. And for those of you who haven't experienced a mobile text-based real-time count, happy to put you in contact with any of our existing clients. William Snow from HUD did a really effective webinar about the advantages of mobile tech, which we can send you the links to that recording. But the virtues are real. We were on the other side of conducting a paper-based count, and You know, but again, others can speak to its virtues as well. I think the biggest thing is the time savings, the accuracy. And the back to GPS enabled supports geospatial reporting capabilities. We also have conditional logic built into the custom surveys that are supported. And so that means that you're not asking questions that are irrelevant to your target audience. You wouldn't ask a 12-year-old, you know, if he or she is a vet, for example. You can customize the labels and the response values themselves. Key thing is we need to be asking the right questions in order to get the HUD point in time report out. So there are certain questions we wouldn't say lock down, but they're more rigid. You can change how the question's phrased, et cetera, but you need to have the input in order to get the output. But during the count, your data quality checks. It does have the ability to do offline data capture. So if you're in an area without internet access, you can save a survey and submit it later. There is support. You know, a lot of our focus tends to be on the unsheltered count. HMIS is not rock solid for every community. The 100% participation rate is a rarity. And then even if you do have everyone participating, getting them all to use HMIS effectively is also a rarity. So we do support a shelter-based surveys as well, where you can actually have your organizations and your shelters available from a dropdown, and they're doing the same data captures you do in the streets, but to make sure you're getting a good data capture for that population too. And then, you know, some flexibility on what questions get asked. You know, one of the things we want to be able to do is smooth out the trend lines. Things like COVID, and right now we're having California wildfires. You're seeing, you know, repeatedly hurricanes hit the Southeast. You know, if you're doing good work throughout the year and then one of these events happens to your community, we want to be able to back those numbers out so we can see what the trend analysis would have been if all things being equal. So we're comparing apples to apples. And asking those questions during the count helps support the smoothing of those trend lines. And then after the count, to be able to do geospatial reporting, generate HUD compliant reports, both at the COC level, but also even at the local level, you know, smaller jurisdictions, cities and towns. You know, mayors have requests for data. You want to be able to support those. And then you've got your post-count outreach opportunities. So you're using the data from the pit to inform the worker street outreach. Now we want coordinated entry to include everyone, not just people that show up at shelters. So to be able to build up those by name lists and supports continuous engagement model where you're bringing people into the community, one interaction at a time is the ideal, and not just treating the count as a reporting exercise. It's a chance to help people. So pre-count, let's dive a little deeper into the pre-count phase and what you could be doing between now and that last week in January. So focusing on known locations, there's different ways to go about doing this. We have added a new known location survey to basically identify places where people are known to be experiencing homelessness. The information can be using the same Counting Us app. It's a simple one-question survey where you're asking how many people are in this location and that experiencing homelessness. And it can be anywhere from 0 to whatever. But from there, we can actually create heat maps to help inform the number of people in an area. And if 0 is data too, by the way. So to know that no one's in the area is good information to have. That you're believed to be no one in the area. And then if it's a higher number, we need to think about targeting more resources towards that area when it comes time for the count. So it's a very simple, intuitive, dropping a pinpoint on the map and attaching a number to it. But that is available now. And again, you're basically trying to figure out, use this time wisely between now and the count to say, where do we have homeless people in our community that so when we go out to do the volunteer allocations for these teams, where should we send them? Now, we also have other tech, and it's a sister app. And I call it that because it uses the same GPS-enabled surveying technology, But the difference being is show the way, and there's details at showtheway.info about more about what it is an ongoing street outreach app that supports this data capture in a similar way, but it's all year round. So there's a very simple observation tally where you're saying, I'm encountering someone experiencing homelessness. There's a baked-in community resource directory, which consumes data from your HMIS systems, no matter what system that is, and it seeds a resource directory that you can add information to. So within HMIS, you've got the basic constructs and what's called the program descriptor data elements of the organizations, the projects, the beds they have. But there's some missing information if you really want to support a community resource directory and support information referral, which ideally coordinated entry is baked in. But things like operating hours, eligibility, documentation requirements, those are things that you want to be adding to those over time. Services provided, languages spoken. Those are bolt-ons that we don't capture in HMIS, but to be able to take data from HMIS, use that as a system of record, add to it, and then make that data, expose that data so that people that are helping people on the streets and ultimately people, on the streets themselves can be using this information to help themselves. But that's all kind of baked into the resource directory. And then beyond that, an encampment screening tool, there's different reasons for that. The CDC guidance I brought up, knowing where your concentrations are. For COVID in particular, to know the people that are staying in the same location. Proximity does matter, when it comes to outbreaks. And then, wildfires right here in California are a good example of why it's important to know where your encampments are. Ideally you can target resources, do preventative measures if people are to have fires, et cetera. So knowing where your encampments is important for that as well. And also, sending outreach teams, ideally you can say, you need to go to this physical location, here's a map, because there's 15 people living out behind this door or whatever it might be. So you're, a little bit more effective, planning and resource allocation when it comes to your outreach teams. So in this case, this is using the known location survey. And basically what it is you're dropping points on a map, and this is the view from the command center, so the data that gets received. And what we can do is we can color code the pinpoints. We set the scaling in that. These are pinpoints. We can also do a heat map. But what you're doing is you're identifying areas known to experience homeless people, and then you from there to be able to involve the community in the response. So, when you're soliciting volunteers, you're ideally looking for volunteers in areas of high concentration. If your southwest corner has a high population of people experiencing homelessness, then maybe you should target your volunteer efforts there as well, is the basic premise of that. Known locations for encampments. I'm going to leave this going for a minute. What you're seeing is the ability to use the map-based interface through the Show the Way app, capture some basic information about that encampment, and save it off. So again, I'll let this toggle through. We can add pictures to it. Sometimes an encampment may have a better way to approach the encampment. You might need some visual cues for other outreach workers to know how to find access to it. So, I know from some of the outreach, work we've done just in doing field tests, there are certain areas where, there's a safe way in, there's a not so safe way in. No one likes to be snuck up on, so there's those thoughts too. And then also being able to toggle an encampment on or off, or it's active or inactive. Some communities do regular sweeps, people move on, an encampment becomes inactive. And then, months later, it's a little bit of a whack-a-mole game in some communities. They come back to the original encampment after they got swept out of the second one. So to be able to turn an encampment area on or off is important as well. So, but these features can be added to, you might have a date where encampment's going to be swept. and to be able to target resources between now and then to say, we've got these people staying at this encampment that we need to help now, or they're going to lose their belongings, they're going to lose their pets. And it's going to be, that kind of trauma on someone could be avoided. So, the idea is to be able to be informed response to what's happening in the community. So on the geospatial tools, this is where, in this case, we're seeing a map of one census tract in downtown San Diego, but to be able to log the known locations of people experiencing homelessness ahead of time, and then designate coverage areas for count teams, based on the concentration. So if you have a whole lot of people in an area, you need more volunteers. It's basically as simple as that. And then ideally, you want to have tools in place, which is mobile tech supports, ways to minimize the contact between the volunteers and people experiencing homelessness themselves. So obviously with a paper-based approach, that paper needs to be gathered in one place and disseminated from the count leaders to the volunteers, with the clipboards and interacting with the person. And then, once the surveys are done, be brought back to a central area and then everything compiled. Well, with mobile tech, we can avoid that altogether by having everything set up ahead of time. Having the volunteers assigned to count teams that are parts of regions, conducting virtual trainings, doing as much as we can to limit, person-to-person contact, volunteer to volunteer, volunteer to admin, volunteer to person experiencing homelessness, et cetera. So digitize the volunteer registration process, the trainings, and then again, the assigning the volunteers to areas of high concentration to make sure we have proper coverage. Kevin, if you don't mind, I think it would be good for you to take on, given your work on these features in particular.
Of course, happy to speak about this. So on the note of volunteers, they are, metaphorically speaking, the backbone of the point-in-time count. So they're a vital part of being able to canvass the area that we need to canvass and find and take the census count of those individuals experiencing homelessness. So what we want to do during this COVID time is really focus on the efforts prior to the point in time and use this time to gather those volunteers and provide messaging out to them, give them some information about some of the difficulties that we're facing and needing them, and really just also give them background on the point in time. A lot of people don't actually have the expertise or the knowledge that we do just because they're not familiar with it, but some of them are, of course, willing to help out for the cause if they are provided some information. So over here on this screen, we're looking at a sample volunteer portal. Again, just some information in the beginning, and you can see here at the bottom, we're able to register and update that registration at a later point in time for any information that we're gathering. So we can gather some basic information, such as whether or not individuals have cars, whether or not they're willing to do ride sharing with other individuals, and a little bit about their experience as well. What's not shown here is the ability for us to capture some custom questions. So if we want to ask some things that are related to COVID specifically, any fears that they have, any expertise they may have, and any background that can be also included. And then we can use that to help proportion out the volunteers to where we need them to go to. I don't know if I'm able to click. I do apologize for this. Alrighty. Sorry, it's a little delay in the load controls resume. But on that last slide, one note to make is just that the whole purpose of this is not only to communicate information and gather that information, but also to integrate with the command center. And we'll kind of show that in the next slide. But we can basically show volunteers what's available for them to sign up for, which areas for them to sign up for, and then get them proportioned out to those different areas. Alrighty, so as I said, here's a view into the command center. So here we're taking a look at the different regions that are set up. These can be set up in any kind of way that you need them to be, just geographically, north, south, what have you. I can kind of see here, here's one specific region where the green census tracts are what that region covers. And then within that region, we can then subset that into separate teams. So we can say, individuals A, B, and C, or Charlie, Joe, and Mary are going over to these specific areas. And you might have seen on one of the previous slides, they can actually see that specific coverage that they're assigned to go to within the app itself. So this is just part of correctly navigating the different areas out there. And all of this takes into account the different geographies that you set up, which we can take some of the known locations to help inform how we want to set up those areas, and then how many volunteers are required for those areas. You can see on that first slide, we're having a quota. So we have the number of users that we want, number of volunteers that we want per region. We can help set that up using known locations, saying, okay, we have this amount of concentration in this area, so let's try to get this amount of volunteers. Once that volunteer quota has been hit, we can just turn that access off in the volunteer portal so that we can then have other volunteers that are signing up go to different areas that we need assistance in. So we're just trying to get ahead of that game and try to make sure that the process is easier on you all, and the process is easier on the volunteers signing up, so they know what they're expecting and where they're going to be going. All righty. Oh, sorry. Back one slide. All righty. So taking a little bit of a better look into the coverage maps themselves. Again, these are the maps that will be defined in the command center, but the volunteers and other users can see within the app. This is something that's new for the 2021. We added some different colors just to help really get an overview map of what's actively being covered. So you can then create other maps and other teams as needed. I guess that's about it. Sorry.
No, that's great.
Yeah, we do have one question here from Anna. Is there a maximum number of regions we can set? There is not a maximum number. So you can have as many regions as you want and as many teams as you want. There's one stipulation that you can only have one census tract covered by one team. That's just so that we have no overlapping coverage and no wasted effort from the volunteers. And thank you, Gordon. I'm glad that you love the team coloring. Really, what's not shown here is the overall response map. You can then pull up all of the regions and teams to see exactly where your gaps are, and then go in and fill those with additional teams.
Excellent.
From Andrea, do regions from last year carry over, or do you recreate them this year? This is something that we can discuss. I hate to put my foot in my mouth in front of everybody, but I'm going to do it. We're going to carry over to other regions. It's we don't want to recreate all this effort, and it's something that we can copy over, and then you can adjust for the new activity.
Yeah. So I think that would be something you send to the help desk. So we don't do it, for you, but you on request, you would ask, can I have our regions brought over, just in case you wanted to start fresh too. We don't want to make a false assumption. One thing that's worth noting with the region management too versus teams is you can set up a regional administrator. So for those COCs that are pretty large, to be able to break down the count into more manageable chunks. And, by having a regional administrator, he or she is seeing the incoming survey data just that pertains to that region. So, you can have this hierarchy where you have a account admin seeing everything for the entire state or COC. It could be state with multiple COCs too. And then you have just different layers like a responsibility. So, the northwest corner, this person's in charge of that, and, monitoring the incoming data quality, making sure people aren't straying out of their area, providing training, guidance, assigning, people to count teams, et cetera. But that way you're really just kind of spreading out the responsibility. So just an important note of the delineation between a region, which could have a regional administrator, and count teams, which are basically taking that region and breaking up to more manageable chunks. Even, so you have yet another layer. So you've got this full COC or state, actually you can go state, you can go COC, down to region, down to team areas.
Yep. So, in summation, for the pre-planning stage, we're just trying to get ahead of the game, use this time that we have now to identify different areas of concentration so we can better distribute the volunteers, and then use the mapping functionalities to then help guide that process along the way. So,
all right. Thank you.
The next one.
All right. So that was all before the count. We haven't started the count yet. So we'll keep this one relatively short because it is pretty well automated. But it's a couple of concepts, things to ponder for your actual count. For the youth counts, a lot of regions that are doing youth counts will actually expand upon that time frame that they're doing the youth count, and they might use 7 to 10 days, still asking where were you homeless on the night, where were you sleeping? And not sorry, I don't want to assume homelessness. Where are you sleeping on the night of the 23rd or whatever? And that way you have the ability to use less volunteers to ideally survey more people. There's that idea. So yeah, again, focusing on a single night, but canvas over multiple days. And then, to be able to keep your count active for a longer period of time. So, we have the ability to toggle your count, or you have the ability to toggle your count on and off, but to leave it going for a little bit longer is going to be, provide a little bit more breathing room to do that data capture. We have some communities that are already doing that. They're doing a point in time count over 2 or 3 days. But potentially, if we could, if need be, we can expand it even further. And again, we might be relying on some HUD guidance here and approval, saying, look, we're faced with a shortage of volunteers. This is what we like to do. So something to AAQ just to get validation that this is a sound approach for you. That wouldn't hurt. So again, this is a picture of the map itself. So if you were assigned to a team area, in this case, and it would show up in the app. So you would know, are you in your area when you're dropping a pinpoint or not? So people have an idea, am I going to where I was told to go? This whole technology stack supports remote deployment. So typically there's it's the distribution or the deployment site, sorry, oftentimes are a place to gather together, get some quick training. It tends to be a PR event. And, you might, take that outside to start off if you're still going to do it. But, the idea of having training up front and have people know most information, you can really minimize the need for that. And this might not be the year to have everyone gather in one place and then go back out and do their thing. So to minimize these large gatherings by supporting upfront planning and, telling people this is where you need to go, have them submit some test surveys ahead of time, you should be good to go. You can also minimize the number of in-depth surveys, and this is all to community appetite. I know a lot of communities are trying to engage more and more people, and that's there's definitely a benefit of doing that. But if for whatever reason, it's too much of a risk to do that, if you had to, you could conduct more observations than surveys. 6 feet distance is something we practice when we go to the grocery store, with PPE. So, if you can engage someone, keep the conversations discreet. If you're in one of the situations where typically you would get closer and whisper for certain questions, like this is domestic violence questions, this is saving condition questions. If you can't do that, then, it could be encouragement to say, what, just out of, respect for the person, just skip over those questions. And we can use other tools to back into some of that information, and we'll explain those in a bit. And then, having the real-time data management in the command center to have everything coming in, knowing what your counts are in real time, and seeing the data and being able to run reports, that night is all doable. With some data cleanup, you're not going to publish anything, but just to be able to have a ballpark of where things are. So it's Counting Us. This is an example of the surveying technology in Counting Us. So it does support custom questions and custom tags. What's being shown is conditional logic. In this case, if date of birth is entered, you won't need to enter in the age range or age, and if age is entered, you don't need to enter an age range. So it's an example of that. Which paper, you can't do that with paper. And then the
Hey,
command
Mac,
center, go
we
ahead.
have one question, just
Yeah.
about observations. Could you clarify on whether or not observations are thrown out when reporting to HUD or on the HUD reports themselves? This question is coming from Sue Legal.
No, they're not. They're not thrown out at all. And actually, we're going to hit on an extrapolation tool that combines the observation data with the interview data. So you'll see that in a minute. I mean, there are some questions that you're not going to be able to get from an observation, but you can pull in some key information, some key demographics, enough to satisfy the report. So things that you can visually observe about someone, age range. You know, you can visually observe what you believe to be their race, what you believe to be their gender. You know, so, but you're not going to be able to say, you know, definitively this person's a veteran, for example, or definitively this person has this condition. So those questions are left unanswered. But when added to the extrapolation, we're able to get tight counts. And we'll show that. It's a good question. So again, can't consider real-time data collection or monitoring data quality. I'm not going to hit on that too much. The geospatial reporting tools during the count, you can make sure that you have coverage so you can see the pinpoints falling on the map. You know, you can see if there's gaps in the area. You know, maybe you have, you know, a count team that goes AWOL. I'm not really sure, you know, but you also have, you know, potentially people, you know, wandering beyond your COC boundaries. And you know, you'll see the pinpoints drop if that happens, and you can be like, hey, you must have taken a wrong turn, kind of thing. And then you get the updates real time, both on the map and the list view and the report view. So we have a dashboard as well. Everything is rendered in real time. Any questions before I get into after the count that came up in the chat?
Yes, we have some conversation about the concerns for data integrity and the validity of using observations.
Great, let's head on. And we have, I'm gonna let Dan Tregley is here with us too, and I think we might, you know, use his expertise a little bit on that. This is not a perfect science, I can say that, but we can have controls in place to make it as strong and as tight as possible. So that's a teaser for Dan in a minute, but we'll go through some of the post count activities which would involve you know, trying to tighten up with, you know, the margin of error from having observation tallies versus actual surveys.
And I think it's important just to note that this is a potential approach to helping the point in time happen during COVID. The goal is still to collect full surveys. Observations are just a way to supplement that information. And then in conjunction with real-time data collection, trying to get ahead of the data quality issues and really be on top of the oversight within the command center to say and see how many errors are coming in, and generally like whether or not these volunteers are gathering the information they need to be. If you can see real-time volunteers submitting observations where they just have race over and over and over and nothing else, for example, it's pretty clear that you can reach out to that volunteer right then and there, get them some additional training, of course, training ahead of the point in time as well. So
if you're seeing one person that's all they're doing is observations, then you have their information and you can reach out to them and say, hey, I need you to slow down and start capturing more information. Or if you're not comfortable doing this, you know, we can have you do something else and have someone else cover your area. So, you know, the idea of observation tallies existed pre-COVID. And, you know, it's anytime you're not comfortable engaging someone, or maybe that you don't want to disturb them, maybe they're incoherent, they don't speak the same language as you, it's a safety risk, you know, you feel, at risk approaching that person. There are different reasons why you might conduct an observation tally. You know, again, the goal is to have as few of those as possible, so you can actually get the rest of the information that's really important for research purposes. But you know, the reality is you can't engage everyone through our community typically. I haven't seen a 100% hit rate yet on surveys, let's put it that way, and we've done plenty of these. So new feature for this year, it was actually built in the wake of COVID, is this notion of assigning tags. Now the tags you're seeing here are related to COVID. So you're seeing things about testing positive, whether they're quarantined, et cetera. But the tag feature can be used any way you want. So these are all customizable tags that you can create. So you can, for data quality monitoring purposes, you can say needs further review, for example, or missing what have you, missing core information, or is this person homeless? You question the sleeping location or some of the details, or is a potential duplicate, however you want it to flag it. And this also could be used to support your by name list recorded entry. Maybe you have some vets housing coming available and someone's a vet and you want to tag all your vets. You could do that too. So there's different ways to apply this, but the point is by adding a filter, you later on can sort by those filters. By adding a tag, you can filter by those tags. So that's what this new feature is. The geospatial tools, again, this kind of goes back after the count. What are you doing with the data you've gathered? Again, you can create regional point-in-time reports. You can create heat maps, but what are you doing with that information? So maybe you have a need for maybe you have a need for a shelter in a certain area or more services in a certain area. To be able to take this data and overlay it with your resource information is informative. We have certain communities that we work with where a bedroom community of another is really service rich, and it looks on paper as if they're the ones with the homeless problem, but in reality they're the ones that are doing the work to address homelessness, and they're taking in people from the neighboring community. And this kind of geospatial mapping can help show that, especially when you overlay more additional information, like where was the last place that you were permanently housed, which is a question that we're advocating people add to the point in time count, by the way, because then we can start doing not only geospatial research on where they're found, but also thinking about upstream, where were they housed when they became homeless, so that way we can look at things like that's available, data that's available in the census, for example, like housing rent burden and fair market rents and household composition and racial characteristics and breakdown. So, what else can you do with the data? These are the times to be thinking about what kind of research questions you want to ask later, because if you don't do the setup properly, you won't be able to get to that. In this case, we're talking about allocations of resources in the community, for COVID, meals, waters, hand washing stations, and other resources, PPE. But again, it extends, the virtues extend well beyond COVID. School districts, if you think about that, do we have equal funding, and what's the ramifications of underfunded schools on homelessness? That's interesting, and you can do that with geospatial data. So again, annual data can be used to inform other efforts like outreach and to get out the vote campaigns, et cetera. So this is another new feature I'm excited to share. For those of you in the past that were downloading the data after the fact and sorting to find like people that have the same last name or same characteristics, what you'll see now is we have a new feature using Amazon Web Services has a feature called Glue. And what it is a machine learning algorithm where you're identifying first, it's going to take a first pass and identify potential duplicates, but you're basically training this engine to say people with these characteristics are likely to be duplicates or not. So every time you choose a match, it's actually learning from that. And what you're able to do is you're able to update your information on a record. So say you've got you have two records, two surveys. They both look pretty good, but one's a little bit more complete than the other. Maybe one has veteran status answered and one has race answered. To be able to create one composite record and archive the other, if you do agree that they're a duplicate. And things to be looking at are, not only the core demographics, but is this person physically located in the same place as the other person or pretty close to it? If someone, someone's not going to magically shift from one side of the county to the other within, 10-minute span. So if you were to see two of those, you're like, you know what, this is probably two different people. But to be able to use location as well as the other information, and then archive, a record as needed if there are duplicates. So that piece is in play now. Any questions on this new feature before I jump over? Okay. And then, the idea of using these built-in drill downs, all the reports can be run by an area, but all the report figures, you can actually click on those to get a list. So, if gender is missing, for example, with data quality checks, and, you want to get a list of the 42 people missing gender, for example, you can click on that number and then have a list to work off of. Just say, all right, and some communities will look at the first name, for example, and there are tools out there. You can get a probabilistic, probability of, the person's gender based on a name. That's not official HUD guidance, but this is your data to manage. So there are things that can be done there. And then also just going back to the person that did the survey and say, hey, you didn't fill this information in. And ideally, you do it quickly so they don't forget. And then again, when the pre-built drill downs, you can actually export the data and choose what you're exporting and then work off that list.
What's not shown in that one slide, just to make a note, you can also open up that response. You're able to then view who submitted that response and assign tags there. So if you want to coordinate with your local admins and say, this needs review, you need to filter by this tag, they can do that.
Nice. Thank you. Okay. Demographic extrapolation. This goes back to the original question. Let me just see if let's see. Oh, this is two sides. So basically, as you'll see over on the left, there's a little checkbox run with demographic extrapolation. So some of you may be familiar with the HUD extrapolation tool. It's an Excel-based tool. And what it's doing is it's trying to have 100% coverage of all of your key demographics. And what it's going to do is it's going to infer the results for those that are missing based on what was captured. And Dan, I don't mean to put you on the spot here, but I think extrapolation, sampling, and enumeration are common strategies in the field of statistics. So I don't know if there's anything that you want to touch on as it being a proven practice, something that you need to do in order to do reporting over.
First of all, thank you, whoever on your team keeps unmuting me after I mute myself, because you all don't need to listen to my children in the other room. So, I mean, we can talk about this a little bit here or a little bit later, just the value of a sampling strategy. And I don't know if that was what you wanted to talk about here, Matt, or...
Actually, we can wait just a second. So actually, let's show right here, here's the actual counts. And then you have your estimates that are based on the unknowns. So you're basically, in this case, you will see you have an estimate that's kind of based on a multiplier. And then beyond that, you have a response rate that you really don't want to do extrapolation. Correct me if I'm wrong, Dan, you're the expert. If your baseline response rate is too low, right?
Yeah, if you don't have a large enough kind of group to extrapolate from, then you're going to be wary of those extrapolations. But as Genevieve points out in the chat here, right, you're going to have some non-responses, you're going to have some people sleeping, and there will almost always be some level of extrapolation. And to the extent that you want that to be kind of a statistically robust and rigorous process, and you want to have as many interviews done as you can, so your observations are kind of well founded in the data.
Yeah. Good point, Joe. Glad you could join. Sorry.
I think HUD's guidance is 80% or above. So this report can be used as kind of a guideline to say, oh, I need to hit 80%. So let me go and find those that are missing and try to fill in where I can, and work a little bit smarter and targeting which responses you can update for missing demographics.
All right. And when it's all said and done, we need to prepare and submit these reports to HUD. So gathering your data from your different data sources, it could be HMIS. We have an Excel-based tool for domestic violence providers that, and then we have the Counting Us app that actually can support both sheltered and unsheltered. But to get it all in one place and aggregate it to, we use a common results format to support that. And we can help support the aggregation work that, when you take your unsheltered and add it to your sheltered and create a final. But at the end, it's compiling results, getting to HUD, and then starting to use it to affect the work in the community. But this is probably more in line, Dan, with where your expertise could come in. And I think, the idea here is, let's just assume the worst case scenario, your volunteer counts are down and you have a large area to cover. And this actually could be even regardless of COVID. For some of your communities, they're just, gigantic. And, the balance of states continues of care, tend to come to mind here, where you've got such a large coverage area. It's really a large undertaking to get enough volunteers to canvass everything. How can you do this properly without, sending one volunteer to cover a fifth of the state, and just assume that those figures are going to be accurate. So one of the things we could talk about here is the idea of a sampling methodology. And so this was grabbed from the point in time methodology guide, but in reality, a census is you're trying to count everyone, right? So you're going through and you count. In this case, you counted all 10 people. And the sampling strategy, in this case, the sample size is a little too small, but that as long as it's an appropriate sample size, you can survey and engage a portion of the population, and how you think about your sampling strategy is a separate conversation, and derive estimates based on who you were able to engage. And this is similar. So you've got a census where you're going door to door, and you're capturing everything or everyone. You can do a non-random sample plus extrapolation. So the extrapolation in this case is filling in the blanks for that one that didn't answer something. So we just kind of showed there. And then the idea of doing a census or doing a combination of of different, both the extrapolation and a random sample could also be done. And this is where we talk about how the approach we're using for Connecticut. So just to put this in perspective of showing how this can work locally. For the state of Connecticut, Dan worked with us as he was consulted on the creation of a methodology. And what you're seeing is we're using known locations from Connecticut of people experiencing homelessness. So we can use last year's point in time count, information from outreach, et cetera, to say, here's areas where we believe there are people experiencing homelessness. Those areas are going to be canvassed. We're targeting resources towards those. And then what you're left with is these low probability areas or places where we don't know there's going to be someone. And we need to think about a strategy to make sure that we can get coverage and get an accurate count. So Dan, I don't know if you want to speak to the random sample model and anything related to this, but how it weighs out, or the model that we was using in Connecticut.
Sure. I won't go on too long because I know that we're at 1:57 right now, but I will say that I think there's kind of more and more of a need to move toward kind of statistically robust random sampling or stratified random sampling, which is what that is, models. This way, where you're going, what areas you've missed, and you understand how to develop a kind of generalizable sample and a generalizable finding that you can then extrapolate to your other areas, right? If you have, 2,500 or even 1,000, census tracts, you can't go to all of that. You physically can't. And so what you can do is some version of what we did in Connecticut and what I've done in some other places, which is this have stratified sample where you go to every place you're going to expect to find people. And then you take all of the other areas and you go to a random sample of those. You have to make sure that random sample is large enough. And that means you kind of need to bring in volunteers. And in this day and age, it means you can't kind of gather 200 people in a single gym because you can't do that at this moment. But those are kind of robust methods for doing that. And especially, I don't know how many of you saw that the Government Accountability Office, the GAO, put out a report in, I want to say August, about the PIT methodology. And a lot of their concern was that people are using kind of convenient samples or non-random samples, either saying that's everything a COC has, or they're trying to extrapolate off of those. And there are concerns there because you can't do statistically robust extrapolations, and it's hard to develop margins of error. Well, in a kind of a model like this, we can do that in a very intentional way.
Absolutely. And I think the impact on the administration of the count and the number of volunteers needed is significant. In this case, we're surveying less than 40% of the census tracts in Connecticut to derive a reliable estimate. So it's something to weigh in. It's maybe 250% larger in theory to do the whole state of an exercise. So something to weigh in, and it's not for everyone. Let's put it that way. So, but something that could be done with geospatial data collection and some proper setup up front. We're near our end.
Let me also make a point. You've been talking about the geospatial data collection, and I think there's kind of an important piece there, which isn't often kind of integrated into a lot of conversations, which is that information gives us a lot of data about who we may be missing, right? Once we understand kind of the geographic and socioeconomic correlates of kind of where people experiencing unsheltered homelessness are, we can use that information to try to kind of make predictions or guesses where other people may be. And that's important as we're trying to improve our PIT counts, but even more importantly, as we're trying to just improve the services that we're offering. We want to make sure we're capturing everybody.
Yeah, it's a really good point. It's a really good point. A lot of times we go into these counts assuming that we have a strong lens into what's happening, but some of the data can help tease out some things like, maybe we should look deeper over in this area because it checks all the boxes of where we've seen high concentrations elsewhere. Yeah,
as a researcher, right, I kind of love data. I want you all to collect more data, and a lack of data makes me cry. And it doesn't take much. And this is one of those places where I think the data are where there's such a gap in that data, and where it could be so useful. And especially as social services are evolving to be more kind of tech driven. Yeah. The integration, kind of extracting that geospatial data from it and then mapping it and matching it with, census data and other data that can really help us understand where people are staying, why people are staying there, and then, targeting services more effectively.
I love it. And just for those that are on the call, I mean, we're doing this all together, right? So we have your individual COCs work, but currently we have 30% coverage of the entire United States using this tech stack. So the type of data analysis that could be done in research and evaluation and the feedback loop, so we don't have to wait a full year for the point in time results to be released potentially. We have a strong enough sample, even with what we have, that we could potentially derive estimates for the entire country earlier, rather than having to wait a full year to take action. So the ramifications of doing this properly are the benefits are pretty significant. So it's a very good point. We're just gonna, I left the screen open. Hope you had a chance to review it. But there have been significant updates to not only our tech stack, but also our team here, support team here at Simtech, to make sure we have effective counts for this coming year. This is something that, yes, it's an annual exercise, but it's not something that we at Simtech just look at once a year. We're always looking at it. So, happy to take questions after, now, if there have any, and set up follow-on calls individually with the regions on. This won't be the last time that we're going to be talking about both point in time. We're also going to have follow-on conversations related to new partnerships with a new partnership with Miracle Messages, support family reunification, which is really exciting development here. Taking the point in time count and using it as a chance to help reunite people with loved ones. It's the right thing to do, and it's an opportunity, but it's an optional opportunity for you to engage in. And then yes, the advancements would show the way for ongoing street outreach and really helping to connect with people living on the streets in a more effective way. So do we have any questions in the chat that we can?
So I can address, there's a question from Hannah there that Kevin got to, but I can speak to that a little bit from my work with you all and just kind of my other work on kind of trying to identify where people are ahead of a pit count when you're trying to make those high probability and high and low probability designations. I think there is certainly evidence that most areas most high probability areas tend to be the same from year to year, and most low probability areas are the same from year to year, but that's not always the case. So as you're doing that, right, I strongly recommend, and Kevin mentioned that there, but I'll chime in to say, getting that kind of a refresh of that information from people on the ground, or just a confirmation of that list from people on the ground, as updated as you can, is really important. Because otherwise, you designate some.
Yep. Thanks, Dan. And just to add on to that, that's kind of what we can also use with the known location survey to kind of inform someone with high probability designations and compare and contrast. That's just another way to gather feedback.
Very good. Any other questions in the chat? Okay, well, being respectful of everyone's time, you can always reach out to us directly. So it's team@Simtech Solutions. First off, it shows the resources that we're using behind this. And we will make this available to you. And then beyond that, if you need to reach out to us, you can either go to pointintime.info and there's a contact form, or you can email us directly using the team@simtechsolutions.com address. Or you can reach out to us one-on-one. So if you want, it's matt@simtechsolutions.com. We basically use our first names. We're not very formal here. So Nikki, Kevin, Becky at simtechsolutions.com. So you can do it that way as well. But we really look forward to working with you. We want to support your work. We appreciate everything you're doing. So if there's anything we can be doing better to help support you, please let us know. But with all that, stay healthy, be well, and we hope to talk to you all soon. Okay, take care.